Hi, my name's Joe and this is the second video in my journey with prostate cancer. If you haven't watched the first video, then I recommend you have a look at that one first, because some of this might not actually make sense. But what I will do is I'll do a little recap when I carry on with my journey. I'll warn you that I'm not necessarily going to be PC. I'm going to be using layman terms so it's easy to understand. I might try and instill a little bit of humour, and I'll try not to swear too much this time. Firstly, I just want to thank everybody that has subscribed to my channel, and an even bigger thank you for the comments that you've actually posted and all the kind words. We've got a great community going on here with loads of personal experiences, lots of advice, good news, bad news, sad news, you name it. But it's great. It's helping me, and hopefully it will help others as well. I think if you actually want to get involved in our little club that we're going on here, that you need to have a YouTube account. It's quick and easy to set up, but if you set one up, you can actually get involved and start posting some comments. So what I'm going to do now is just a quick recap. In February of 2023, my PSA was 13.6. I had an MRI followed by a biopsy. I'm not going to talk about that. I had a PET scan, and I was diagnosed with metastatic cancer. It was present in the gland, in my lymphatic system, and also the lymph node to the left of my neck, and also my jizz bags, my seminal vessels. So I'll just quickly show you what I showed in the last video, just to refresh your memories. Okay, so this is the PET scan that I had last year. I was obviously injected with a radioactive tracer that's clung to the prostate cancer cells, and here you can see an indication there on the prostate going up the lymphatic system on the left hand side. No idea what that is on the right hand side, and then there's a gap, and then there's a marker there on the lymph node to the left of the neck. The aim of the next course of action was to do a biopsy of that lymph node there to see if it's prostate cancer related. Also, it actually attacked my seminal vesicles, my jizz bags. These are the bags that contain most of the fluid that you ejaculate. Obviously, some comes from your ball bag as well. So, lymphatic system, seminal vesicles, and the prostate. Okay, before I go any further, I just want to make a few corrections to my last video, having watched it. One of the things that I said when I started getting my hormone therapy injection was that I had to take this pill called bicalutamide, and then I was going to get an injection, a Prostate 3 injection. This was my hormone therapy. The way it came across in the video was that I took this bicalutamide, then after I finished that course, I then was injected with the Prostate 3 injection. What I should have said, or the way it should have come across, was I had to take the bicalutamide for about 3 to 7 days before the Prostate 3 injection. That would then counter the surge that I was going to get from the Prostate 3 injection. And then for another 21 days, in total 28 days, you still carry on taking those tablets. So that was the first correction. The other correction that I want to point out, and I'm sure you got the gist of it anyway, is what I said, that when we get older, the prostate ages. Well, obviously it ages. I mean, what I should have said was it enlarges as we get older. Okay, it's not as if every time we get our car service we could have a new prostate put in, which would be lovely, wouldn't it? Now, I did get one other post. Out of the 400 comments that I've had so far, there was one person who wished me well, and he said that, was I being racist? He was referring to when I had my biopsy. In the video, if you watched it, I said that I had a biopsy about, I don't know, maybe 18, 20 years ago. And the guy that actually did the DRE, he was an Asian guy with nice slender fingers. I refer to the guy who did this latest biopsy as Banana Man because he had huge fingers. So I know where he was coming from, but it wasn't the Asian guy I was calling Banana Man. It was the doctor that did the latest biopsy. I know I did say that I wouldn't necessarily be PC, but I'm definitely not going to be racist. Okay, so it's the end of June 2023, and I turn up for my neck biopsy to see if it's prostate cancer related. I was much more relaxed this time because I guess that banana man wouldn't be shoving his finger up my arse. He still hasn't texted me. Let's hope not. So, in I go for my biopsy, and I found out that they weren't going to do it because the lymph node was too close to the jugular and it would be dangerous. Now, don't know why I didn't get a phone call beforehand just to say don't bother turning up, but she still did a ultrasound of my neck area, and she asked me if I had any problems with the thyroid, and I says yes, and I'm getting treatment for it. I'm on pills for it. So I was a little bit pissed to find out that I got something wrong with my thyroid and I had to pay for parking. So at this stage I was no wiser whether it was PC or prostate cancer related. Obviously my concern was with it being there, a bit close to the brain, could it be something more sinister? I don't know. So August comes and I have a meeting with my consultant, and I'm told that my PSA is down from 13.6 to 1, and that's due to the hormone therapy that I'm on, and I've been on it now for 2 months. And then what he said was that we're going to do another PET scan to see if there's any changes because of the hormone therapy. At that meeting I told him that my waterworks weren't performing very well. I had a weak stream, not emptying the bladder. So what he did was he put me on to pamsuleucin, which is supposed to relax the muscles in the gland, the prostate, and hopefully I can start pissing like a horse again. He also prescribed me solifenacin, and that's to treat an overactive bladder. So if you keep watching to the end, I'm going to cover the side effects that I'm experiencing from taking that bit of medication, and keep going right to the end if you want to, because there might be a little bit of humour. So 4 weeks later, after my PET scan, it was exactly the same as before. Radioactive tracer, wait for about 15 minutes, and then in you go and have your PET scan, which takes about 25 to 30 minutes. It's now September, and I meet with a consultant again, and I'm told that due to my hormone therapy, the lymph node activity had decreased, and I managed to get another image of it on my phone, which I'm going to show you now. Okay, so this was the first scan that I had, and the clarity is not too bad in it. The second scan that I had, resolution is pretty poor, but what it did say was that it seems to be working well. The hormone therapy doesn't seem to be quite as aggressive. Now, whether that's true or not, I'm not too sure, because they're not identical pictures with resolution in that, but it does look like it seems to have decreased a little bit on the neck. I did say to him, I says, what's this huge marker here? And he says, that's the radioactive tracer that's gone into your bladder. For a minute I thought, Jesus, the prostate's even got worse. If we compare the two, you can see there's no comparison with resolution, but if you can believe what they or he said, it does look like it's not quite as aggressive, and that certainly looks like it's smaller. Now, one thing I encountered when I had the first PET scan, whilst I was waiting for that time to actually go and get the PET scan, I went on my iPad. I had it on my lap, lying on this bed, just doing a crossword or whatever. And when I went in for my second one, I was told no electronic devices. So I wonder if the fact that I had my iPad there, it actually affected it in any way. I don't know. So if you do go for a PET scan, make sure you don't go on any electronic devices beforehand. Don't know why they didn't tell me that the first time, but hey ho. Okay, so the consultant then admitted that he hadn't actually seen them, which did surprise me a little bit, but I suppose other people will then analyse the images and then give him their findings. I was then put onto a hormone therapy drug called apalutamide. Magic. Now, apalutamide, or Erleada is the brand name. It's a type of hormone therapy treatment, and it comes in tablet form, and they're designed to hit the cancer as hard as possible. A point to note is that it will not cure the cancer, the same as hormone therapy as in the Prostate 3 injections. But what it will do is it will control and slow down the process. And he said that we're going to go along this path before we even look at any other radical treatments. So we'll have to wait and see what happens in the future. But I've no idea at the moment how long I'm going to be on them, but we'll just have to wait and see. Now let's fast forward now to November 23, and I get a telephone conversation with the consultant, and I'm told that my PSA is now down to 0.1. However, my thyroid was even more underactive, so they had to up my medication. Now, I did a little bit of research, and it does show that apalutamide does interact with thyroid medication. So I'll need to ask you something about that if anyone else has got thyroid issues later on. I told him that my piss stream was a lot better than it was before, but the sulfonacin wasn't working at all, and I was still pissing for England, and I wasn't emptying the bladder. My urgency to go to the toilet was certainly keeping me fit with all the sprinting I had to do to get to the loo. So he said that he was going to change me from sulfonacin to mirabegron, and to see if that has helped. Okay, so it's now January of 2024. And I've been on both those medications for a good couple of months now, and I still have to keep sprinting to the toilet when I need to go. So I don't think the bladder medication is working for me. So in my next review, I can mention it to the consultant. In December of 2023, I was put on monthly blood checks instead of fortnightly ones. And I'll be having an appointment very, very soon with the specialist nurse, and that's going to be followed up with a consultation in a couple of months with the urologist, my consultant. What I'm going to do now is I'm just going to talk about the reaction I'm having to the medication that I'm on currently and the side effects. Now, with all medications, there's going to be common, uncommon, rare, all the way up to unknown side effects. But I'm just going to deal with the common ones, unless I encounter something different. Okay, so we'll start off with the waterworks. Sulfonacin. Now, I've got a load of literature here, but the side effects are the common ones. Headaches, not really, didn't encounter that. Dizziness, I'd say that, yes, I was getting that. Bend down, pick up, do your shoes up or something like that. When you stand up, I was getting head rush. Farting and burping, yeah, well, I'm a bloke. And blurred vision, well, if I take my glasses off, then I would have blurred vision. So the sulfonacin, those were the side effects. But then I changed to mirabegron. And if I have a look at this leaflet, some of the side effects, remember this is the one that's going to relax the bladder. Increased heart rate, no. Infection of the structures that carry urine, no. Nausea, not really. Constipation, not really. Headaches, not really. Diarrhea, not really. Dizziness, same as the other one, just a little bit of head rush. Vaginal infection, nah. Swelling of the joints, not really. Itching of the vulva or vagina, nah. I don't think anything else affects me. So not really too many side effects with the mirabegron. However, what's not listed on here is that it can help with ED, erectile dysfunction. So that's interesting. Now let's talk about tamsulosin. Okay, so the side effects here. Dizziness, well, I've already covered that. Head rush. Abnormal ejaculation. Ooh, ejaculation disorder. Basically what they're talking about here is retrograde. So when you come your muck, instead of it coming out your knob, it's going to go back into the bladder. I wish I could have an ejaculation. Headaches, rapid heart rate, not really. Dizziness, once again, head rush. Runny, itchy nose, diarrhea, vomiting, itching rash, including nettle rash, feeling of weakness, feel a bit tired. So not too many there, but very rare. It does say that prolonged and painful erections that can last for several hours. I wish I could have one of those. God. What's not actually listed is that it can, tamsulosin, affect libido. Certainly finding that. So let's now move on to apalutamide, good old Erleader. Side effects, very common. Feeling very tired, but I'm not sleeping that well anyway. Joint pain, not really. Skin rash, no. Decreased appetite, no. High blood pressure, no. Hot flushes, big style, day and night. Diarrhea, no. Broken bones, no. Falls, no. Weight loss, no. Muscle spasms, itching, hair loss, not at the moment. Change in sense of taste. So those are the common side effects with apalutamide. But one other thing it does mention is underactive thyroid. It can cause the thyroid to become underactive. Now in my case, it's already underactive, and that's why my meds were upped. Now I have been experiencing numbness, pins and needles, and pain in the balls of my feet for a good couple of months now. Now it's actually very painful to walk. Now I don't know whether this is related to the thyroid. It could be diabetes, but I have had glucose checks and I'm told that I'm not diabetic, so I don't really know. So my question is that if there's anyone out there who is on apalutamide or a similar type of hormone therapy drug as a chemo drug, are you getting thyroid checks, making sure that it's not becoming underactive? And if you are on thyroid medication, are you experiencing any pains in the balls of your feet? Also your hands, are you getting pins and needles, the feeling that your hands are swollen when in fact they're not? So if you could leave a comment if that's applicable, that would be actually brilliant. So let's move on to Prostate 3, the dreaded hormone therapy. So, extreme tiredness. Well, I don't sleep that well anyway, and it could be down to stress, and I'm sure a lot of you might be encountering that. Weight gain, I would say I'm putting on a little bit of weight, but we've just had Christmas, so that's not surprising. Loss of body hair, not really. Bone thinning, well, if that's going to happen, then that's going to be because there's a lack of testosterone, which helps to keep our bones nice and strong. Strength and muscle loss, so it's good to train. Now, I used to be a personal trainer, and when I had older clients, I used to say to them, bone density, muscle mass starts to decrease as we get older. So I would always encourage weight-bearing exercise. It's great doing cardio and incorporating that in your training cycle, but definitely weight-bearing exercises as well. Hot flushes is another one, and they can last anything from 30 seconds to about 5 minutes. I'm getting them big style, day and night, and I experience them really mostly after I've just eaten. So I suppose once I put that energy in my body, I certainly get a hot flush. Good in one way, because I remember last year I had the heating on. This year, during the winter months, I haven't had to put the heating on because I'm just getting hot flushes all the time. So price of my energy bills are certainly a little bit lower. But I think I'd rather pay the extra and not have these hot flushes. Now, changes to sex life. Now, in my case, I don't think about it. I don't dream about it. I don't wake up with a stiffy anymore. It's horrible. Hopefully one day I might be able to come off it, because it's not good. It's not good, as I'm sure most of you are aware, and people have commented on that subject. Maybe they should give this to sex offenders. Breast swelling and mood changes. Well, yeah, possibly. So let's just see if there's any more. No, I think that's covered most of it. One thing that's not actually listed here is that I've noticed that I've got rubber ship map reading. I'm really struggling now to reverse my car. and I keep shouting, "Put the toilet seat down!" And I was adamant that because of my hot flushes, I wanted a pink van. That's sexist, some might say, in the great words of Greg Gutfield. So that's my story so far. Once again, thank you for all the comments that you've put on the channel, and thank you once again for subscribing. It means a lot. My thoughts and my prayers are with you all, and watch this space for another update. One final thing, on my channel there's a lot of rubbish. In your opinion, maybe. There's kite surfing stuff, Harley Davidson, even a static caravan winter drain down. What I've done is I've created a playlist, so if you're only interested in prostate cancer, just scroll down, find that playlist, and all of the prostate cancer ones will be on there. Thanks for watching. Until my next one, please keep commenting. Bye for now.